Ladies and gentlemen, we will begin shortly, so the minister will be coming in a few minutes. I just ask that when he comes in that you stand to acknowledge his presence. Thank you. We'll be starting shortly. Ladies and gentlemen, Dr. the Honorable Nigel Clark, Minister of Finance and the Public Service. Ladies and gentlemen, you may be seated. Good afternoon, ladies and gentlemen, and welcome to the visibility ceremony for the non-reimbursable financing agreement from the European Union Caribbean Investment Facility to support the health systems program between the government of Jamaica and the Inter-American Development Bank. My name is Daniel Pasley, and I will be your moderator for this afternoon. As per the program, we'll be having the welcome and opening remarks by Dr. the Honorable Nigel Clark, Minister of Finance and the Public Service. We'll also have remarks by Her Excellency Marianne Van Steen, Ambassador and Head of Delegation for the European Union. After which, we'll have remarks by Mrs. Therese Turner-Jones, General Manager for the Country Department of the Caribbean Group of the Inter-American Development Bank, after which we'll have remarks by the Honorable Christopher Tufton, Minister of Health and Wellness. He has tendered apologies as he is running a little bit late. After which we'll have the closing remarks by Dr. the Honorable Nigel Clark, and then we'll have a nice photo op. I'll now ask Minister to give his remarks.
Protocol that when we speak, we can take the mask off. Well, let me first begin by welcoming everyone to this afternoon's ceremony. Obviously, the Ambassador of the European Union to Jamaica, Ms. Marianne Van Steen, ambassadors and chargé d'affaires from other member states of the EU, France, Spain, and Germany, I believe. President or Managing Director of the IDB for the Caribbean, Mrs. Therese Turner-Jones, Financial Secretary, Ms. Darlene Morrison, and Dr. Wayne Jones, Dr. Wayne Henry from the Planning Institute of Jamaica, DFS, and other members of the Ministry of Finance and from the media. This is actually my first face-to-face event of this size and nature in over 15 months. And so forgive me if I, forget a few things here or there. I haven't been doing it for a long time. But it's very good to be here this afternoon for the recognition and celebration of the EU's participation and the EU's grant towards Jamaica's health sector. The European Union, with whom Jamaica started a programmed coordination in 1975, is the largest provider of grants to Jamaica, and the European Union's work covers a number of areas, which include citizen security, the justice reform program. They have also worked in forestry, in public financial management, in child mortality and mother mortality. I see that they're now working and supporting the Big E program that the IDB has, and a number of other areas. And today we are recognizing one of those areas, which is the EU's grant of over 10 million euros to support health capacity in Jamaica. Now, that grant is pursuant to a series of loan agreements that we have with the IDB, and those loan agreements were entered into in 2018, an investment loan and policy-based loans, which are designed to strengthen the hospital capacity or the health capacity system in Jamaica. In a very innovative way, the European Union grant proceeds that we celebrate here this afternoon will complement the IDB loans that we entered into in 2018, and providing a strengthening of health centers in the regions that are, or in the what they call in the catchment area of the hospitals that are going to be upgraded with the proceeds of the IDB facility. And that way, what we get is leverage, right? That we are working with the IDB to strengthen health capacity at the hospitals, and the grants provided by the EU will allow for the clinics in the catchment areas to also be upgraded, thereby increasing the outcomes that we have as far as NCD prevalence and management is concerned. So the government of Jamaica is very pleased with this cooperation, and very grateful to the European Union for the visionary way in which this grant is assisting in areas that we're working on, and helping to make those objectives a reality. So I just want to welcome you all here this afternoon for the sign-in or for the celebratory event, and I'll ask Ambassador to say a few words.
Thank you very much, Minister. I'm going to take a little bit of distance. I think also for me and for most of the people here in the room, it's the first time that we are indeed again having this kind of face-to-face events, and I'm extremely happy for that. Would like to greet as well Mrs. Turner-Jones of the IDB, country representative in Jamaica. Also, of course, to the Director General, Financial Secretary, and my dear colleagues, ambassadors of the European Union. I don't think we've ever been together in this kind of event, so I'm very happy that this is the case today. I'm happy that we are celebrating what we are celebrating today, because it signals the European Union's continued commitment to support Jamaica where it can and where it thinks that it can have an added value. Even if it would probably not be expected in these times of COVID, the grant that we are signing today, or that we're celebrating today, is not aiming to increase Jamaica's health sector capacity to face the COVID crisis, but to help the country to address another major health challenge, which is the one posed by non-communicable diseases. Examples of non-communicable diseases are cardiovascular diseases, cancer, chronic respiratory diseases, diabetes, and so many more. They may receive less attention in these days, but they are there and they cannot be neglected, as they are often the cause of disability, ill health, health-related retirement, premature death, all of these sufferings exacerbated by considerable social and economic costs. In Europe, according to the OECD, every year approximately 550,000 people of working age die prematurely from non-communicable diseases. They're one of the leading causes of mortality in the European Union and account for almost 1% of GDP annually. In most middle-income developing countries, such as Jamaica, one can also note a worrying increase of the population's vulnerability to chronic non-communicable diseases. And even if we do not have all the up-to-date statistics, but if we look back to the year 1990 to the year 2016, a bit more than 25 years, we have been able to note an increase of more than 5% of mortality of non-communicable diseases. And we do not expect that this is a percentage that will go down soon. All the more important are the efforts of the government of Jamaica, with the help of its friends, to address non-communicable diseases in a structured and decisive way. The European Union applauds the health systems program of the government of Jamaica together with the Inter-American Development Bank. And the European Union is very proud that as a long-term partner and friend of Jamaica, it can contribute to the success of this program with a non-reimbursable grant of, indeed, a little bit more than 10 million euro. I tried to do the calculation. It's pretty difficult for me, all those zeros, but I think it's about 1.8 billion Jamaican dollars. I hope I'm not mistaken. It was very difficult. So it is quite substantive. The grant will be used to rehabilitate or build 10 health centers in St. Catherine, St. Anne, and in Clarendon. The facilities to be upgraded or to be built were selected by the Ministry of Health and Wellness, and we are very pleased that those facilities are mainly situated in rural areas, because we know that there is where the needs are highest. We do expect that having access to these upgraded new facilities and adequately trained staff, thereby offering more efficient and higher quality care, will change the lives of many. Let me give an example. The health center that we will build in Brownstown in the hills of St. Anne will replace the present health center that is struggling with limited space capacity, old and inadequate infrastructure, unavailability of equipment, especially with respect to laboratory and treatment, limited availability of pharmacy services, and for the moment is therefore completely dependent on the St. Anne's Bay Hospital for these services. And thanks to our support, we very much hope that the new facility that will be built will have an approximate floor area of 23,000 square feet, while at the moment it is only about 1,300 square feet. There will also be a brand new treatment and emergency operating center. And I just thought it was useful to actually give that as an example. I'm not going to refer to all the other things which will be done with our support, but I think this one is very, very illustrative. So let me conclude by congratulating all actors involved in this health system strengthening program, not in the least the IDB, that has a very prominent role, Ministry of Health as well. And we have no doubt that this program will help Jamaica to save lives. And I do not think that I'm wrong when I say that over the last, it's already 16 months that we are in this COVID pandemic. We have probably all still a little bit more on how important it is to do something about our health and to save lives. Thank you so much for your attention.
Mrs. Teresina Jones, you may also give your remarks.
Thank you very much. Like Minister, I'm feeling a bit strange. This is also my first outing. And the weirdest thing is to be having on a proper dress and shoes. I'm not used to that anymore. But also, I want to recognize my colleagues, Ambassador Stein and the other ambassadors from the EU. Lorenzo Escondeur, who's our new Chief of Operations to my extreme left. First time he's meeting any of you since he arrived in January. It's a pleasure to be with you, Minister, and to see the FS and PIOJ Director and our colleagues who I've only seen on screens over the last 16 months, so it's very weird. We're all aging, but we're not realizing it until we see each other. And by the way, all of my male colleagues and friends seem to be getting bigger. The women, I think, are doing fine, but the males are sort of like... Anyway, it's really a pleasure to be here, especially to be, as Ambassador Stein put it, to be celebrating this collaboration. And it's a really good example of how the IDB leverages its balance sheet to bring on, of course, our partners, and EU is a major partner for the IDB in several projects in Jamaica and around this region. When we were starting the health project in 2018, of course, there was no idea that we would be in a pandemic 2 years later. And so the project wasn't really designed with COVID in mind. And I must say, I have to commend the Ministry of Health and the PEU for persisting in carrying out some of the objectives in these very difficult times. As Ambassador mentioned, the main object of this particular project is to improve the health of every Jamaican citizen. And we're doing that in a couple of ways, but I think the most important one is what was mentioned earlier, which is focusing on NCDs. When we started this engagement with the Minister of Health back, we actually started discussing this probably in 2017. Where should the effort be? Should it be infrastructure, or should it be on trying to address the diseases directly? Our experts at the bank said a good way to deal with health issues in any country today is to try to get at the root causes of a particular disease, for example, diabetes, which is a very prevalent NCD. And by the way, Ambassador, NCDs kill more Caribbean people every year than any other kind of disease. NCDs is a lifestyle disease. So by focusing on preventing NCDs, looking at policy reforms, including things like non-smoking laws, which Jamaica already has, not many countries around our region have that on the books already, go a long way in preventing what can be the exacerbation of health problems as a result of some of these NCDs. So that's the first thing. Second thing was to focus on some crumbling infrastructure. And I must say, when I went around with the team at the Spanish Town Hospital, I've talked about this before, so forgive me for those of you who've heard it. Part of the loan funds from the IDB will be going to rehabilitate a part of the Spanish Town Hospital. But what was obvious to me at the time was that this loan alone could not address all of the needs of Spanish Town Hospital. So in the case of the EU grant, for example, those funds will be directed mostly at 6 clinics. The ambassador mentioned the one in St. Anne, but there's also one in Maypen, and there's several others, Clarendon, Mocho. I'm not exactly sure where Mocho is. Moco. Mocho, like the Japanese ice cream. But the infrastructure, again, is only a second part of the exercise. The other, what I think is an even more important part, is focusing on the health information system and putting as much as possible in a digital format so that not only are the records of Jamaicans tracked properly. For example, if you go to Spanish Town Hospital and you go into the basement, that's where the records are kept. And that's a pretty scary room because manila folders piled up on top of desks, and that's not, I think that's not the best way to keep health records today. And this goes along with, as the minister knows, Jamaica's attempt to put most of its, at least public information, in a digital format so that, one, there's more efficiency, two, there's better tracking and monitoring of the information, but also, as far as health goes, it'll be an important tool for helping be more efficient in terms of addressing the needs of the populations where they're at, if we know where that information is and who's sick and who's not sick. But also, it's moving Jamaica's health ministry and system in a modern direction. So these are the main objectives of the program. And I want to say that while this is a very complex project to execute, because as you can imagine, rehabilitating hospitals and the primary care clinics requires some expert attention. So it's not just designing any old building, it's designing a building that's fit for the health purposes. And so it's required a lot of attention. But I think in the end, the health system in Jamaica will be a lot better for it. And we're hoping that this investment in Jamaica's health infrastructure will be the first of many, because as I mentioned with the Spanish Town Hospital, eventually, Minister, we really want a new hospital to replace the old Spanish Town Hospital, which I think is almost 160 years old or something like that. It's old, it's crumbling. It's not fit for purpose anymore, and it's overcrowded. I think these efforts will go a long way in improving that facility as well as the primary clinics. And why the primary clinics? The primary clinics because, as we all know, if we can avoid people actually having to go into a hospital in the first place, and they can get their care, because primary care, basically, most of the care that most people need who go to hospitals can be done in primary health clinics. Something like 85% of all of the needs that people have when they go to a hospital can actually be dealt with in a primary care clinic where they can get, so for example, mothers, prenatal, postnatal, children going for their immunizations and so on, NCD checkups, those can be done in primary care clinics as opposed to going to the hospitals, which can really deal with hospitalizations for those people who've had surgery and so on. So I think it's really important to focus on those areas. It's important to focus on primary care. And in the policy reforms related to NCDs, getting those messages out, I think the Minister of Health has been doing a Herculean effort on the Jamaica Moves project and getting every Jamaican to be concerned about their health. All of these messages, I think, really help, because the way medicine is going today, a lot of patients now go into the doctor's office with a lot of information about whatever problem they have, because information is readily available. Not all helpful, but a lot of information is available now through various means on the internet, and people are becoming very savvy about their health. So I congratulate the Ministry of Finance and the Ministry of Health for reaching this milestone today. Our partner, the EU, for providing the grant financing, which of course lowers the debt burden for Jamaica, because the grant funds can be blended with the IDB funds, which cost money, although it's a concessional rate. But by blending the funds with grants, the financing for Jamaica becomes much more bearable to the budget. So thank you very much for hosting us, and we look forward to every success in this project. Thank you very much.
Thank you, Mrs. Therese Turner-Jones. I have been informed that Minister Tufton is still on his way, but I'm going to ask the media if they have any questions, that they can also chime in, and so that persons of the public can have a better understanding. Do you have any questions? All right, we have no questions from the media. In that case, we'll ask Dr. Clark to give your closing remarks.
Thank you. The Ministry of Finance, we try to keep it, to the point, which means that you'll come back again. But today is really a very important milestone, and it's important to mark it with an event such as this. I like the way the ambassador put it, $1.8 billion in Jamaican dollars in the context of our budgetary realities is a significant amount. And the title of the ceremony is, non-reimbursable financing. What that means, that's all techno geek. What that means is money we don't have to pay back, which for a country that has been burdened over a long period of time with indebtedness, that's a big deal. It's a really big deal. and it's an even better deal because of the use to which these funds are going to be put. Jamaica will be focused on building its human capital as much as we are on building our physical infrastructure. Human capital development is of crucial importance. And non-communicable diseases, as Ambassador and Turner-Jones have both said, rob Jamaica of productivity. It is the leading cause of death. 8 of the 10 leading causes of death are NCDs, and over 85% of deaths in Jamaica, according to the health statistics, are on account of NCDs. Not to mention the lost hours due to hospitalizations, amputations, etc., from diabetes. So if we are focused on developing the human capital of Jamaica, we have to be focused on limiting the negative impact of NCDs, and certainly this $1.8 billion grant from the European Union goes a long way in helping to achieve this. We look forward to seeing the clinics in St. Anne and in Clarendon and St. Catherine, and look forward to further collaboration with the EU and the IDB on building human capital in Jamaica. Thank you all for coming out. We are going to just take a few photographs so we can, if there's no photo in today's world, it did not happen. Okay, so we have to have a photograph. And then, notwithstanding our focus on NCDs this morning, there are some refreshments behind. It's all about moderation, right? So it's all about moderation. There's sweets there we won't report, but just consume moderately. Thank you all very much for coming, Master Ceremonies.
Yes, Dr. Clark. Mr. Andrew Lately from the Jamaica Observer, he has a question.
We're trying to see if we can get him.
So, Mr. Lately, you may unmute your mic.
Hi, good afternoon. Can you hear me?
Low.
It's a little bit low.
Can you hear me clearer? No?
All right, let's speak a little bit more, Andrew.
Microphone check, audio, checking for sound, audio and clarity.
All right, Andrew, you may ask your question. Just go ahead. All right, if you're not able to, we're not hearing you. So what I'm asking you to do, just to type your question in the chat, and we'll communicate same.
Okay, I was wondering if you're hearing me clear or no.
That's better.
Yes, hearing you better now.
All right, thank you very much. All right, so my question is to the Finance Minister. I've realized recently that Jamaica has signed on to the minimum tax, the international tax, for large corporations, and I wanted to find out from you whether there's an understanding of how that tax will be dispersed, and who will benefit from that kind of a tax.
I know that there are some similarities in the sense that of the 130 countries, at least 4 or 5 of them are represented here today. But apart from that, there's not much similarity with the subject area of your question and the subject of today's proceedings. Out of respect to the European Union and to the significance of this $1.8 billion grant, I would rather not deflect from the importance of that by answering the question. At another time, in another place, I'm very happy to answer the question that you've asked.
All right, and we have another question by Ms. Charnel Henry from the Jamaica Information Service.
The question is, what is the value of the contribution of the IDB?
You may repeat that question again.
What is the value of the contribution from the IDB?
The IDB, the government of Jamaica entered into a series of loans from the IDB. So that's a different, today with the EU, we're talking about a grant, which is non-reimbursable, a grant we don't have to pay back. In 2018, the government signed a series of loans with the IDB, investment loans and project policy-based loans that total is 155 million US dollars. Okay, but so you've already reported on that in 2018. I don't want to see any reports about borrow more or anything like that. those loans were signed 3 years ago.
We have a follow-up. Can the communities to be impacted by this grant be listed?
Can you go ahead?
Because I was going by memory, but hold on a second. Okay, so we have, under the grant, upgrade of 6 health clinics in St. Anne's Bay, that the ambassador referred to, Chapelton, Moco, that's what it's pronounced. Moco, St. Jago, Maypen West, and Greater Portmore.
All right, thank you so much. I have just been informed that Minister Tufton is here and he is currently coming to the door, so we're just going to just bear with us for a little bit. And here he is, the grand entrance. So ladies and gentlemen, let us bring special greetings to the Honorable Dr. Christopher Tufton, Minister of Health and Wellness, giving his elbow bumps. Minister Tufton, you may give your remarks. You can just, take a breather.
All right, thank you.
And then you may go ahead. Thank you.
First of all, let me find how to turn this on. It's on? Oh, okay. I put on my glasses, then I would have known it's on. So I rarely am waited on in this fashion with so many very important people. But I want to apologize, Minister. Sorry about that. Madam Ambassador, delegation, ladies and gentlemen, I had an emergency which I had to tend to, and it was family related, so, and then the traffic. So the Honorable Nigel Clark, Minister of Finance and the Public Service, Her Excellency Marini Van Steen, European Ambassador to Jamaica, European Union, Ms. Darlene Morrison, Financial Secretary, Ministry of Finance and Planning. Is the PS here, my PS? No? Okay, well, let me recognize him anyway. He has done a lot of work. Mr. Dunstan Bryan, Mrs. Therese Turner Jones, General Manager, Country Department, Caribbean Group. Other specially invited guests who are here, distinguished ladies and gentlemen, and I see Dr. Wayne Henry of the PIOJ. How are you, sir? So we gather to recognize the European Union's contribution in the sum of 10.2 million euros to the support for the health systems program for the prevention and care management of non-communicable diseases in Jamaica. The EU's contribution augments the US $50 million being provided for the program under a loan agreement with the Inter-American Development Bank, and will go a far way in helping to ensure the best possible health outcomes for Jamaicans using the public health system. The case of this program has been well made, I believe, and it has been a long time in planning. I recall the meeting in Washington, the first meeting, and then so many other meetings after, and of course the support of the government, Ministry of Finance being key to that, the Planning Institute and others. But that case is grounded in the health profile of our population, which as a country we all have to be concerned about, and indeed is directly linked to the progress that we make as a country, not just from a health perspective, but a sustainable development perspective. And that, some of those data is compelling. 70% of Jamaicans, for example, die from a lifestyle non-communicable disease. We have on average 18,000 deaths a year, 70% of that. And you're talking about cardiovascular disease, cancers, hypertension-related stuff, strokes, and so on. And a fair bit of that number represents premature death. So if you speak to a life expectancy of 70 plus years, there are so many of us who die long before that, which clearly has significant implications for how our economy functions. 1 in 3 Jamaicans are hypertensive. 40% of them do not know until they have a serious condition. 1 in 8 live with diabetes, and 1 in 2 are overweight or obese, putting them at risk for these other NCDs. So that's the context, that's the justification, that's the reason why this is such an important initiative. The data reflects the clear and present danger of the scourge of NCDs affecting the population, which warrants change in the operation and management of the public health system, guided by a chronic care model that allows for interventions at the patient, provider, and systems level, together with the renewal of primary health care, which we're working on a plan for that. So the health system strengthening program tackles these needs full on, hence the appreciation for this contribution, enabling needed improvements to the physical infrastructure of 3 hospitals and 10 healthcare facilities, health centers that is, and providing them with the required medical equipment to support the delivery of care. It also supports the creation of a strong foundation for a digital health ecosystem, notably an health information system for health that sees the transfer of paper records to digital format while promising collaborative care, cost control, and the use of big data to diagnose and treat individual patients while enhancing the overall management of the health of Jamaicans. So like in business, Minister, we're about transaction time and cost reduction. And the health information system is a major enabler so that patients do not wait the length of time that they would normally wait when we try to go and find a file in some room somewhere that is dusty, and then of course the networking of functions which provides more prompt care, saving lives and easing stress. The program also takes us further along the road to fulfilling the World Health Organization's criteria for a well-functioning health system characterized by improving the health status of individuals, families, and communities, and the offer of protection against the financial consequences of ill health, as we see with the current free healthcare policy, together with the provision of equitable access to people-centered care. This program, ladies and gentlemen, is also a good example of what is possible for public health when a group of committed partners get together in the public health interests. And of course, I'm referencing here the EU, which is a longtime friend of Jamaica. Health has benefited significantly, and I did have the opportunity to serve in agriculture. And similarly so, the EU has been a significant partner in that area. And of course, the IDB, which has made its business to provide financial and technical support for countries working to improve health and advance infrastructure. So I pause here to note my very special thanks to these partners, again, for the support of this program, which represents the single largest investment in public health infrastructure, I would say, in decades. So this is really a game changer for us. As I noted at the official launch of the program last year, the effort is a big deal for us. It comes after 3 decades of a health system resource below the World Health Organization recommended 6% of GDP, though it has been increased to some 4.2%. But the Minister and I are working on increasing it even more in years to come. 30 years without the construction of a single new hospital, and at a time when more than 70% of the current hospital equipment and infrastructure have been assessed as being at their end of life by the normal depreciation method. We still use them, but ideally we need to replace them. Meanwhile, in the period since the launch of the program, finally, we have made some important strides on implementation. These include design work for 11 of the 13 facilities to benefit under the program, and we are going through final approvals. The next invite you get will be a real nice grand display of all those designs. And what I've seen, the preliminary draft, it's rather encouraging. So we are making some progress there. Ongoing rehabilitation of the laundry facilities at 3 hospitals, that has commenced. The ongoing procurement of medical equipment with a focus on enhancing diagnostic screening capabilities, which is actually very critical. And the rollout of innovative telemonitoring training for public health practitioners. We have started that, and that is going fairly well. So in the coming months, we will accelerate those and other efforts under the program to the benefit of the people of Jamaica. So I say again in closing, as I apologize for being late, thank you very much to the EU, to the IDB, to the Ministry of Finance, the PIOJ, and all others. This has really created hope for Jamaicans and encouragement for those in public health who have labored a lot of times under-resourced, but nevertheless are committed. And I believe this will augur well for the advancing of our country as we move forward. Thank you very much.
Thank you, Minister Tufton. Minister Clark, you have something to say? No, I thought you had something to say.
No. As what we said in Ministry of Finance, we get to it and we move on. I've said what I've had to say already.
Great.
I spoke twice. Thank you all for coming. And we're going to take some photos now, right? Yeah.